la deuxième zone pour moi qui est la plus remarquable sur les injections, c'est la zone des lèvres et le remodelage des lèvres. Les techniques qu'on avait précédemment pour injecter les lèvres, c'était des techniques qui étaient invasives, qui provoquaient des ecchymoses, des hématomes, qui étaient douloureuses, qui étaient très difficiles à mettre en pratique, et en plus qui nécessitaient des anesthésies tronculaires, c'était comme les anesthésies de chez les dentistes, avec une injection profonde d'anesthésique qui était à la fois intéressante parce qu'elle supprimait la douleur, mais en plus qui était un inconvénient, parce que quand vous faites une anesthésie tronculaire, vous perdez le mouvement naturel de la lèvre, donc pour corriger une lèvre, il vaut mieux garder un mouvement et avoir le mouvement naturel de façon à mieux voir la position de la lèvre quand vous la corrigez. Donc on va commencer par le côté gauche. Voilà, je vais faire un tout petit point juste à la commissure des deux lèvres. Voilà. Ensuite, nous prenons notre kiss. Par ce petit trou, on glisse notre aiguille, qui elle ne pique pas, et on fait l'injection sous la peau. D'accord ? Et dans notre produit, il y a un petit peu d'anesthésique. Donc, vous ne sentez absolument pas le produit. Voilà, je vais mettre une petite goutte du produit. On va y aller très progressivement, juste à un point de la commissure. Et voilà. Et vous voyez, ça avance pas. Donc il faut mettre le doigt ici déjà, le premier doigt ici. D'accord ? Et après, il faut tirer comme ça. Voilà. Vous voyez ? Et hop, comme ça glisse plus facilement. Le produit de Teosyal est parfait puisqu'il s'appelle Kiss. On compte sur l'effet anesthésiant du produit, car dans cette nouvelle ligne de Teosyal, il y a de l'anesthésique dans le produit, mélangé à l'acide hyaluronique. Donc on compte sur l'effet anesthésiant du produit, mais on n'a pas fait d'anesthésie au préalable. Donc on fait quand même glisser une aiguille le long de la bordure de la lèvre sans anesthésie, ce qui était inconcevable auparavant. Là, dans ce cas-là, l'intérêt, c'est l'aiguille de 27G qui est merveilleuse puisqu'elle glisse le long de la bordure et permet des injections et des restructurations de la lèvre parfaites. Si vous faites la même chose avec une aiguille qui est biseautée, qui coupe et qui a un biseau pointu, c'est quasi impossible de pratiquer. On a presque fait partir les rides péribuccales, hein. Là, je fais un petit point là, ici. Là, on prend du first line, donc un peu plus léger, avec une aiguille plus fine. Ouais, comme elle est plus fine, celle-là, elle glisse beaucoup plus superficiellement que les autres. Elle agit plus sur le derme que sur le volume. Allez-y, gardez le grand sourire. Allez, tirez avec là. Voilà. Bon. On va dire 90% d'amélioration. Ça valait le coup ?
Résumons maintenant pour les lèvres selon la méthode du Dr Herzog. Le diamètre de l'aiguille qui permet de faire l'incision est similaire ou légèrement supérieur au diamètre de l'aiguille souple. L'incision doit être pratiquée juste en utilisant le biseau de l'aiguille sans être enfoncée dans la profondeur. Les points d'injection sont situés à la commissure des lèvres. La technique d'injection requise correspond à une méthode rétrotraçante avec maintien cutané opposé à la direction de l'aiguille. L'injection du produit peut se faire dans le canal virtuel de la jonction de la lèvre rouge avec la peau et peut aussi être fait dans la pulpe. La zone péribuccale est traitée plus superficiellement. Dans le traitement des lèvres, l'utilisation d'une aiguille 27 ou 30G est recommandée. La 30G est recommandée pour le traitement de la zone péribuccale.
Regarding filers, the greatest demand is to treat nasogenian folds. In fact, this name is not appropriate. People should talk about nasolabial lines, as these lines start from the nose and go to the mouth. This is the area young plastic doctors learn to treat first.
Je vous fais un petit trou normal avec une aiguille normale là.
I make a small hole with the normal needle here. Then I introduce the flexible needle and deposit a small drop of product that also anesthetizes, and it contains anesthetic product. And I slide the needle. It's painless, does not hurt. At the beginning, when we were using this needle, we started injecting from the bottom of the line. In fact, it's also more difficult to inject from the bottom to the top. We learned from practice and sharing with colleagues. Finally, it was obvious to us that the best starting point for injection was the upper third of the nasogenian fold. This position is the best to inject correctly the fold, properly deposit the product in the most hollowed part of the line, which is the area close to the nose, and then slide back the needle in the labial area while keeping on injecting the product all the way back into the nasolabial fold. This technique seems to be amazing, but it's important to precise that anesthetic product has been introduced in the nasogenian folds. Consequently, you have to swivel the needle and make it slide the other way round. It is not very painful, as products of the Teosyal Pure Sense new range includes anesthetics. These products are those we are currently using with lidocaine, which is the anesthetics reference. You are going to feel strange sensations in your lips, as there is an anesthetic, okay? This time the needle is off smaller. To put correctly the product in the most hollowed area, next to the nose area, is the best position for injection. Even for the small area, like here, I spread the product like a coating, in the hollow, just under the nose. The first part of injection consists in spreading the product all over, drawing the shape of a fan, in the nose area, toward the nose. The second part concerns the labial area, injecting in the direction of the lips, going down from the top to the bottom.
Sum up for the nasolabial folds area according to Dr. Herzog's method. The diameter of the needle used to make the incision is similar to or slightly larger than the one of the flexible needle. The incision should be made only by using the needle beveled edge without pushing it in depth. The points of injection are located at the upper third of each nasolabial fold, which provides easier access to the high and low part of the fold. This position for the point is better than a lower position. The required injection technique corresponds to a retrograde method with the maintaining of the cutaneous area opposed to the direction of the needle. Injection of a high viscosity product is subcutaneous. To treat nasogenian folds, a 27-gauge needle is recommended.
Alors on va essayer de compenser un peu
So we will try to correct this a bit and move the cheekbones back up.
la hauteur de la pommette. C'est vrai
It's true that a cheekbone treatment is very indicated for this man. The area we call the tear-through is this area. As the fat of the cheekbones melts, lines are growing, like a hollow. It's a normal change of the face. But the melting of the cheekbones fat makes this area progressively collapse. So the injection point is situated in this area, in order to have access to the upper part of the cheekbone and tear-through.
Là, je fais une petite ligne de repère, c'est la ligne de la...
Here, I draw a small landmark. It's the gravity line. I inject the product under the skin. If you rebuild this area, your face will catch the light differently, and you will look well again.
Et donc, hop, ça vous redonne bonne mine. Donc,
Therefore, I introduce the needle vertically. Here we are. It's perfect. I inject a small drop of the product, and then I hold the skin and swivel my needle.
Ensuite, je tiens la peau et je fais pivoter mon aiguille. Faut toujours
Always manipulate and inject with care.
trop brutalement. Je suis obligé de mettre...
I always have to hold my hand like this to maintain the skin properly.
La deuxième partie.
The second part of the intervention consists in injecting while removing softly the needle. The particularity of this injection is to start from one point, and then to swivel the needle, drawing like a fan technique. So you change direction each time.
Évidemment, les demandes chez les hommes, c'est quand même...
Obviously, requests come from men who are very concerned about the way they look. Most of these men are working in the audiovisual industry and come to improve the way they look and their image on the screen in particular.
de maintenir une image, une belle image sur l'écran.
Sum up for the tear-through and cheekbone area according to Dr. Herzog's method. The diameter of the needle used to make the incision is similar to or slightly larger than the one of the flexible needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. The point of injection is located on the vertical line that goes down from the external canthus to the intersection with the tear-through. The required injection technique corresponds to a retrograde method which consists of maintaining the cutaneous area opposed to the direction of the needle. The injection is subcutaneous and can be deeper when approaching the orbital rim of bone. When treating the tear-through, a 25 gauge needle is recommended.
La deuxième zone pour moi qui est la plus...
From my opinion, the second and most remarkable area is the lip area and the remodeling of the lips.
Le remodelage des lèvres. Les techniques qu'on avait précédemment pour injecter les lèvres, c'était des techniques...
The techniques we used before were invasive and painful and causing hematoma and ecchymosis.
Très difficiles à mettre en...
These techniques were difficult to practice, requiring trunk color anesthesia. This is the same type of anesthesia used by a dentist. It means a deep injection of anesthetic product, which is interesting because it makes the pain disappear, but the patient can no longer move her lips naturally. So in order to correct the lips, it's better to keep the natural lips movement, to check her natural way of moving. We'll start with the left side. I will make a small hole precisely at the corner of the two lips. Then we take Teosyal kiss. I introduce our needle in the small hole. It does not sting, but slides, and I inject under the skin. In our Teosyal product, there is a small quantity of anesthetic, so you do not feel the product at all. Here I am, I deposit a small drop of product. I inject very progressively, precisely, at the point of the corner of the lips. As you can see, it does not move forward, so you have to put the first finger here and then put it like this. Then it slides more easily. This Teosyal product is perfect, as it is called KISS. This new Teosyal range proposed product with hyaluronic acid and lidocaine. We do not put anesthetic before injecting because we count on the anesthetic effect of the product. So I introduce the needle and make it slide all along the lip edge without anesthetics. This was not conceivable before. In this case, the important point is to use the 27 gauge needle. It is great because it slides along the edge and provides the perfect lip restructuration. It's almost impossible to practice the same gesture with a beveled cutting needle. Peribuccal wrinkles are almost removed. I make a small hole here. Of course, I use Teosyal first lines, a lighter product with a thinner needle. You can see how the needle is thinner. It slides on a much more superficial level than the other needles. It acts more and more on the dermis than on the volume. Go on, keep smiling. Pull, pull, pull. Here we are. Okay, let's say 90% improvement. It worth it, wasn't it?
Sum up for the lip area according to Dr. Herzog's method. The diameter of the needle used to make the incision is similar to or slightly larger than the one of the flexible needle. The incision should be made only by using the needle beveled edge without inserting it in depth. The points of injection are located at the corner of the lips. The required injection technique corresponds to a retrograde method which consists of maintaining the cutaneous area opposed to the direction of the needle. The injection of the product can be done in the white line of the junction of the red lip with the skin, as well as in the labial pulp. The peribuccal area is treated more superficially. To treat the lips, a 27 or 30 gauge needle is recommended. A 30 gauge needle is recommended to treat the peribuccal area.
We are going to treat the commissural area and the facial contour of the face. This is one of the areas we most frequently treat on a major point of dissatisfaction for many patients. In fact, I position myself at the opposite side of the area to treat, and I introduce the needle in this direction. I make a small hole to inject just on the chin fold. We have searched quite a bit before finding this specific point, because there is a large number of veins on the sides we have to avoid. We experience many options to inject under them, around, on the sides, or laterally, through the lower part of the chin, and so on. As we kept on trying, we found that this point was really the best one to treat on the commissural area. Using this point of injection under the chin fold really enables to work on the area at a global level. As you spread the product in several directions, you treat the chin, the oval, the commissural area, and even the lip corner. High viscosity products are preferred because the product does not spread in all directions and remains in place where it has been injected, in the skin depth. We use a 27 gauge.
Donc à partir de ce point-là,
So, from this point, I can easily go down in the oval and in the commissural area as well.
Je peux aller dans la zone commissurale aussi très facilement.
I inject a lot of product because I want to erase the shadow caused by the hollow between the chin and the cheek. Everything is a question of light in your face. By reducing the shadow, you add light to the face, and by adding light, you look younger. Treating the chin is always a bit painful because this area is very fibrous. I said earlier that we were treating the oval as well as the commissural area and the chin to remove the small and visible central lines. Focus on the difference between these two areas. This one on the right is injected, and the one on the left is not. Look at the shadow. The hollow here and the hollow there. Please turn a little bit to me. Here we are. We will do the same thing, just a small hole, precisely into the fold.
Sum up for the commissural area according to Dr. Herzog's method. The diameter of the needle used to make the incision is similar to or slightly larger than the one of the flexible needle. The incision should be made only by using the needle beveled edge without inserting it in depth. The injection points are located on either side of the face in the chin fold to treat both the chin and the commissural area. The required injection technique corresponds to a retrograde method, which consists of maintaining the cutaneous area opposed to the direction of the needle. The product injection takes place in the middle layers of the dermis. When treating the commissural area, a 27 gauge needle is recommended.
The jugal wrinkles refer to the cheeks, In French language, jugal and cheeks have the same linguistic root. It corresponds to the wrinkles that cross the cheeks. They are most of the times caused by a beginning of heliodermy. Heliodermy means the skin loses its elasticity, becomes thinner and more sensitive. It also bleeds more easily. If you scratch the skin suffering from heliodermy, it bleeds immediately. Heliodermy often increases the intensity of cheek wrinkles. Here, I'll have to make several small holes. They are small and superficial. Not even one small drop of blood is coming. I position my needle differently, with a rotation of 45 degrees from the cutaneous surface. I also choose a direction. I keep this direction, which makes the injection easier and less painful.
Ça risque de faire des bleus plus facilement parce que
the most important risk is to cause bruises, because the layer of the skin is thinner. There is no other risk, on the contrary. It is a zone where the skin is thick enough, which enables to make the needles slide easily.
Facilement, ça ne présente pas de particularité. C'est un traitement de la peau. C'est plus un traitement de la peau qu'un traitement des volumes ou un traitement de la ride elle-même.
It is more a skin treatment than a volume treatment or wrinkles treatment. The product is injected more superficially, so that it penetrates the superficial dermis.
Le remplissage au niveau de la peau.
Donc là, les injections qu'on fait, c'est pas seulement des injections pour faire du volume, mais c'est...
These injections are not used to give volumes, but also to revitalize and moisture the skin. As the injections are made superficially, we have to use a low reticulated product suitable for the superficial injection.
Un peu souple qui permet l'injection superficielle.
The sick area of the skin at the cheek level requires more superficial injections. Thinner needles are used. Do you know that the colors of the needles are corresponding to the colors codes? For example, all the 30 gauges needles are yellow. We also use a low viscosity product, such as Teosyal first lines, that enables to inject softly these wrinkles. Despite all this, small ecchymosis can appear when injecting the jugal wrinkles. Normally, the jugal area does not hurt, as it's not a sensitive area on the face. But when you see such wrinkles on the cheeks, it means there is a little bit of fibrosis underneath, and fibrosis prevents the needle to slide easily. Then it hurts a little bit.
Sum up for the jugal area according to Dr. Herzog's method. The diameter of the needle used to make the incision is similar to or slightly larger than the one of the flexible needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. There are multiple injection points located at the ends of the wrinkles so that the entire area is treated. The required injection technique corresponds to a retrograde method, which consists of maintaining the cutaneous area opposed to the direction of the needle. The injection of low viscosity product will be done in the superficial dermis layers. When treating the cheeks, the use of a 30 gauge needle is recommended.
For me, this is one of the most difficult faces area to treat because there are some risks. That's why it's important to find the exact point of injection. First, I make a small hole in the skin at the level of the eye angle. Here, but under the orbital rim. Using this point, I introduce the needle and slide it under the dark circle. Then I inject the product very slowly while removing the needle. It does not hurt at all. It slides, it's not sensitive, and it's very efficient. It took time to find the appropriate injection point. After trying different positions, I think that the best position is just inside the orbitary rim and the eye angle, which allows to slide under the dark circle, both on the outside and the inside.
Qui permet de glisser sous la cerne, à la fois sur l'extérieur et sur l'intérieur de cette cerne. Donc il faut bien se positionner.
So you have to find the correct needle position to avoid all the small veins. I position the needle vertically, and as it's not sharp, it does not sting. The patient almost does not feel it.
Donc vous la sentez à peine. Avec cette technique,
With the flexible microcannula technique, dark circles can be treated softly. You introduce the needle and you can inject the product without causing ecchymosis or hematoma, without specific risk for the patient.
sans risque particulier pour la patiente.
There is a little quantity of anesthetic in the product's formula. That's why patient does not feel the product. And I slowly slip my needle. It is necessary to go slowly, otherwise the product spreads over in all directions, which is not good. High viscosity products are used. They are injected in the depth into the dark circle, so that it raises the level of the skin. The shadow then disappears and the skin catches the light better. Of course, we use a 27-gauge flexible needle, which is flexible enough to position itself more easily in the area we want to treat. It goes relatively in depth. We try to go through the edge of the bone, the rim of the bone that follows the dark circle as much as possible.
Sum up for the dark circle under the eyes and tear-through area according to the Dr. Herzog's method. Patient standing, the point of injection is located at the convergence of two lines, one going down vertically from the external canthus and the other diagonally, slightly above the orbital rim. The diameter of the needle used to make the incision is similar to or slightly larger than the one of the flexible needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. The required injection technique corresponds to a backtracking method with the maintaining of the cutaneous area opposed to the direction of the needle. The injection must be done in depth in order to pass along the edge of the bone. When treating the dark circles, 25 or 27 gauge needles are recommended.
Let's talk about the facial remodeling. because that's finally what we're doing. In the approval study I did with the doctors and surgeons, we noticed that the more you control the injection technique, the more you easily inject, and then you naturally inject more product for the same patient. It is then essential to disinfect, to aseptize the skin and correctly apply an antiseptic product. I will place the injection points by drawing small circles on the skin so I can see the skin. From this point, using this point, I inject like this, and from this other point, I inject like that to remodel the cheek. Then, right away, I make the point of the glabella. The fact to use and control this technique enables to get it only one session. The result we used to get in several sessions. I think that asset, the advantage of this injection technique, is that we can inject more product more easily with less pain for the patient, less bruises, less hematoma. It then makes the work easier because we can inject several syringes.
C'est plus une réalité qu'avant parce qu'on a cette possibilité de le faire. Là, j'ai pris du deep line pour faire le sourcil et la glabelle.
I use deep lines to inject the eyebrow, the glabella. Then I will use ultra deep to inject the cheekbone and the back area of the cheekbone. Finally, I'll use global action on the marionette lines.
Du global action sur la zone de la commissure.
And then use kiss for the lips.
Sur les lèvres. On a des produits qui sont merveilleux maintenant parce que
we now have great products. They are much better tolerated. Our technique is less invasive than before, more bearable. The gesture seems to be more important than before, but less aggressive. The risk of making an ecchymosis with a cutting and sharp needle is twice more important, perhaps even more than twice. First, I'll start injecting here, madam, in the area named the glabella, after the cheeks and the back of the cheeks. Afterwards, we will be able to inject the lips, the nasogenian folds, and the commissural area. It is possible to reduce the wrinkle's depth by injecting hyaluronic acid inside. It is necessary to always make the central point because veins are going through laterally. You put the point at the middle and you slide the needle under the vein. I always use the flexibility of the needle to slide into the skin. It is always more difficult to inject from the top to the bottom than from the bottom to the top. So you always must stretch the skin. It is always the same idea. We apply and spread the product so that it can diffuse itself in the subcutaneous area, like a coating. In most gestures made here, we don't make any ecchymosis, whereas before we put the needle at one point, then inject the product. Come out, re-inject, re-come out again, re-inject. So it was nearly sure to make an ecchymosis. Now the risk has been reduced from 50% to 4.7%.
La technique classique des mains, c'est
The traditional technique for hands is to make a hole between each hollowed area of the metacarpus and to introduce a rigid cannula like this one. It's painful. It requires anesthesia. The magic needle technique is completely different because it enables to go softly through the skin, injecting the product.
d'injecter le produit, de déposer le produit. En positionnant la façon d'injecter, on glisse sous la peau, mais
We position the needle under the skin and inject the hyaluronic acid as coating, as American and Anglo-Saxon people say. We realize a coating, like a new layer under the papillary dermis. The skin regains shape and volume and looks younger.
Et donc ça redonne ce galbe à la peau un plus jeune qui a de la souplesse, etc. Bon, pour les mains, il y a des différents protocoles, mais
To treat hands, there are different protocols. We make 2 holes in the same level,
on met à peu près central, au même niveau, les deux au même niveau.
one on each side. We always avoid veins because we'll go under the vein.
Les veines, parce qu'on va passer sous la veine en fait. On met un peu de produit au départ.
First, we inject a little quantity of the product. We unstick a little bit the skin so that it can slide more easily.
Voilà, ensuite, ça glisse tout seul. We prefer high viscosity products because they are not spreading over and staying in the place where they have been injected, which means in depth. Gel will be applied later. D'avoir ce gel d'acide hyaluronique.
This hyaluronic acid gel, specially designed for post-injection, is a strong asset as it completes the intervention a great deal. It is true that the hands treatment is an excellent indication for this technique, and the results are really amazing.
Sum up for the hands area according to the Dr. Herzog's method. The diameter of the needle used to make the incision is similar to or slightly larger than the one of the flexible needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. 2 injection points are necessary and located on a transversal median line. Their position should be chosen in order to cover the entire cutaneous surface. The required injection technique corresponds to a retrograde method with the maintaining of the cutaneous area opposed to the direction of the needle. The injection is subcutaneous and should pass under the dorsal venous network of the hand. When treating the hands, the use of a 25 or 27 gauge needle is recommended.